Well, good afternoon, everyone. Thank you for joining us today for the presentation implementation of mobile medical units for the delivery of mental health and addiction services in Ohio. My name is Paul Matherney, and I'm with the Healing Communities Study through the Ohio State University Partnering Institution. Just an FYI, this presentation is being recorded and will be archived for future use. We will provide you with a link to the recording and to the slides in the coming days. I would like to briefly introduce our panel. First, we will have Tim Ingram from the Healing Communities Study, University of Cincinnati Partnering Institution. Tim will share background information on HEAL, HCS, and general information on advantages of mobile units. I will then share for just a moment on some of the financial considerations we were presented with during this study. And then following that, we will hear from subject matter experts. Paul Groman, currently at ThedaCare, will talk about how to choose the right mobile unit for your purposes. Then Deanna Vizzi of the Brown County Board of Mental Health and Addiction Services Board and Majda Berryman of the Toledo-Lucas County Health Department will share their direct experience with selecting and deploying mobile medical units in their respective rural and urban areas. Throughout the presentation, Jamie Luster, our research communication specialist, will monitor the chat and will facilitate the Q&A session after the presentation. With that, Tim, will you take it away?
And thank you, Paul. Next slide, please. Well, good afternoon again, and thank you for attending. We have a great panel of experienced professionals, as you just heard from Paul, as he read our introductions. And this great panel of experts is going to provide you their practical insights about the purchasing and operation of mobile medical units in urban and rural environments. Next slide, please. Specifically, we're going to discuss the types of mobile medical services provided by highlighting overdose education and naloxone distribution and other services on the mobile medical units. We'll also be discussing how we have expanded urban and rural reach and the strategies to access underserved populations, and how we bridge some of the treatment gaps and how the role of the mobile medical units have increased the access to these types of services. Basically, mobile medical units provide an innovative and flexible approach to combat the opioid epidemic by delivering the essential harm reduction services directly to the communities in need. Next slide, please. But first, some background information about the Healing Communities Research Study. HEALing is an acronym that means helping to end addiction long-term. It is a multi-site, multi-state study across 4 states, Ohio, Kentucky, New York, and Massachusetts, involving 67 counties that are actively involved in trying to address the opioid epidemic in their localities. In Ohio, there were 18 counties involved with the Healing Communities Study. The primary hypothesis was communities that heal, which we called our 18 counties and throughout Ohio, their interventions will reduce opioid overdose deaths by 40% over a 3-year period of time. The secondary hypothesis was communities that heal will improve access to medications for opioid use disorder, overdose education and naloxone distribution, and increasing the safe prescription or prescribing of opioids and other pain types of medications. And by using all 3 of these strategies, we will reduce all overdose events in these respective communities. Our approach was to implement these evidence-based practices by engaging the community. We actually emphasize with the leadership and the local opioid coalitions and work with their membership to decide the evidence-based practices to implement. In Ohio, our partners were the state agencies and many not-for-profit organizations, but specifically we had the Ohio State University, the University of Cincinnati, Case Western Reserve University, Ohio University, Wright State University, the faith-based community, the Ohio Department of Transportation, Ohio Department of Health, Ohio Mental Health and Addiction Services, Also, the University of Toledo was involved, and the co-principal investigators on the study were the Ohio State University and the University of Cincinnati. The study was funded by the National Institutes of Health through the National Institute on Drug Abuse, better known as NIDA. Next slide, please. It takes a partnership with multiple organizations engaged, starting with the design of the mobile medical unit to the operation of it, for community acceptance to occur. After all, collaboration is the key to success in addressing complex public and mental health challenges like the opioid epidemic. So why use mobile medical units? Next slide, please. There are several reasons why. Mobile medical units bridge the gap in healthcare accessibility by reaching remote hotspot areas and underserved populations where traditional healthcare facilities are scarce and transportation services are limited. Mobile medical units offer flexibility in service delivery, as they can be easily deployed to different locations and times based on the population needs. And as you hear from our panel, I want to stress here that you'll really learn how they use overdose data that they've collected to understand where they need to locate their services. Operating mobile medical units for medical services can be more cost-effective compared to leasing or owning a building to provide clinical services. Mobile medical units are instrumental in delivering preventive healthcare services like harm reduction services, naloxone distribution, medication-assisted treatment services, and even other public health services like vaccinations, health screenings, and health education programs. By bringing the services directly to the communities, mobile medical units may facilitate early detection of health problems, thereby reducing the burden of preventable diseases in their respective communities. And operating mobile medical units may enhance community engagement and trustworthiness by building relationships among clients suffering from opioid use disorder and with the staff. You will hear shortly some stories from Deanna and Maj how this has happened in their respective communities. Next slide, please. However, there are challenges in using mobile medical units. Mobile medical units may have challenges such as related to infrastructure limitations, lack of electricity. You need to have clean water. If you have restrooms on the mobile medical unit, you need access to dump stations and etc. There are resource constraints which involve funding, equipment, and personnel can pose significant challenges to the sustainability and the effectiveness of these mobile medical unit operations. Coordinating mobile medical unit services must occur with the existing public and behavioral health infrastructure and other not-for-profit organizations that are working in that particular space that have a mission aligned with yours in addressing the opioid epidemic. By coordinating and leveraging all these resources in your local community, it's actually essential for patient referrals and follow-up care. There are logistical challenges. Managing scheduling, route planning, vehicle maintenance, and supplies requires careful planning and coordination. Failure to address these logistical challenges may result in service disruptions, delays, or inefficiencies in delivering care. Assigning dedicated staff to manage the mobile medical units, scheduling, and logistical issues is important. When serving diverse communities, the staff must be able to navigate multiple cultures and languages. Understanding their cultural beliefs, language preferences, and socioeconomic factors is important for providing culturally competent care and gaining patient trust. And so with that, I'd like to turn it over to Paul Matherney, again from The Ohio State University, to discuss financing. Paul?
Okay, thanks, Tim. Now I'm just going to quickly go over some of the general information on procurement of the mobile medical units for the Healing Community Study in Ohio. If we could go to the next slide, please. In wave one of the study, we procured 5 units, 2 for urban counties, including Lucas, and the other 3 for rural counties. And in wave 2, we provided another 2 units. For the finance people who are attending, I'd like to share just a little on the procurement process. We first worked with the county HCS team and the service agency to get a clear idea of their desired specifications. If we could go to the next slide, please. To follow university and sponsor procurement policies, we got competitive quotes from various suppliers. This was done during the supply chain issues brought about by the pandemic, so there were a few challenges with that. When we then got concurrence from our federal sponsor, NIDA, and secured all the internal OSU approvals. Some of you might recognize that this process involved a lot of people at many levels, and most everything was considered an exception. It was quite a challenging time. County service agencies were able to operate the units during the study implementation period through a no-cost lease agreement from Ohio State to each agency. And once the study period ended, the units were transferred to the agencies through a gift agreement. Okay, so enough about procurement. Paul Groman, please take it away. Next slide, please.
I think my microphone was not working. I apologize for that. Again, my name is Paul Groman. Really appreciate the time that everyone took today to join this presentation. Appreciate the opportunity. I work as a business development director for a large integrated healthcare system in Wisconsin. No, I'm not sitting in California, as my background suggests. I am in the great state of Wisconsin. And what I'm going to try to present just for a few minutes here is what I think is sort of a unique viewpoint that I have with regards to mobile medical programs. I had the privilege of starting up mobile medical programs, specifically in the opioid disorder space. And then shortly after that, I went to work for a mobile leading vendor of mobile units, actually just out of Toledo, Ohio, Tesco Specialty Vehicles. 50 years in the business, family-owned, wonderful organization. I had the chance to really learn the other side of the equation, the supplier versus the consumer. So putting those two together, my hope is just to share just a few points to think about when you start engaging with securing a mobile unit or expanding your program. Some of the learnings I had from both perspectives. So first off, clearly establishing your purpose and scope of services. That may sound counterintuitive. Why would you engage in securing or building a mobile program without knowing that? But the reality is that happens quite a bit. We run into programs that get funding from various sources. They know they want to start a mobile unit, but they haven't thought through all the strategy. They haven't begun with the end in mind about what they're trying to accomplish. And that really delays a program. Oftentimes, we've had circumstances where the unit arrives before their strategy, their roadmap's even developed, and then the unit sits there. You do not want that to happen, of course. And solid mobile vendors like the one I work for will help you avoid that. But some things to consider, outline the steps that you're going to take. What is your vision? Clearly identify your demographic that you're supporting. Some other important steps is, it's hot mapping locations and adjacent partnerships of where you want to bring your unit. Completing a really thorough pro forma and forecast around your patient volumes, short, mid, and long term, so that you have sustainability. Clearly identify with regards to the modalities that you'll be presenting, the must-haves on a mobile unit, the nice-to-haves, and maybe things that you really truly do not need. That would just be distraction. And then also have your decision-making process clear, because once you start to engage, there's going to be decisions that you need to make quickly so as not to delay the delivery of your vehicle according to your project plan. Some other considerations regarding mobility and accessibility. Again, that often starts with the planning. You're going to want to understand the demographic deeply that you're trying to serve. Such things as, do you need ADL accessibility via wheelchair lift? What is the projected what I would call amount of volume, your tack time of patients presenting at your various locations. That may dictate how many access points that you need to your unit to keep up with demand, and even the size of the vehicle. Are you going to be rural, urban, or both? Oftentimes, we've seen success in mid-sized vehicles that are able to go both in urban settings and rural settings, but there's various considerations regarding that. So again, understand your population, and that'll help you pick a vehicle that makes sense. Additionally, when you work with vendors that are trusted and leading in the industry, they design purpose-built mobile healthcare vehicles that do not require special licensure. That's a question we often get. Do I need a special licensure? No, not if you do this with a trusted vendor. They're going to help you with that, which allows you to have really a lot of flexibility with regards to your staffing model. You can get creative. And these vehicles are oftentimes not as scary as you think in terms of drivability. Some considerations regarding operational efficiency. I would recommend, as you engage with the vendor, to not go in it with the mindset of a brick and mortar design of healthcare. This is mobile medicine. This is street medicine. It's different. So be open-minded to all the learnings that your vendor that you choose has of developing these mobile units over the years. They've taken a lot of these learnings and applied it to standardized models that can be adaptable to your situation. Of course, bring new ideas to the table, but trust that vendor in the design process, because they know how to get you a vehicle as quickly as possible with quality at the right cost. Also, come prepared in your design with the equipment and the power needs of that equipment. That can provide delays in the planning process and even obtaining accurate quotes. And also think about your IT infrastructure needs specific to your internet. Depending if you're rural or urban, there may be different strategies, and having that defined up front will allow your mobile vendor to bring in other subject matter experts as needed to supplement the build out of your mobile unit. Some other considerations, and I think you'll hear this probably in the lessons learned to come, is thinking about your parking situation, especially when not in use. Are you going to go indoor, outdoor, secured? Establishing power to your parking locations, and even working with your hot map in your adjacent partnerships that you may establish where you park your unit to supply care. You could actually consider establishing power at those locations, which would minimize the need to run on generator. It's quieter, and it also reduces maintenance cost. So just a few tips and tricks there. Finally, another consideration is standardization versus customization. Don't need to spend a lot of time on this, but kind of with that brick and mortar mindset, think standardization. Use what's there and been established. Again, tweaking to your needs. That'll help you with speed to market. It'll help you with consistency of your maintenance. These are pieces of equipment. From time to time, there is issues that occur. Having a standardized approach to your vehicles using standard units will allow your vendor to quickly identify the parts needed to fix it, or the maintenance that needs to occur to get you back on the road quickly. Standardization truly helps with that. And then, of course, ongoing training for your staff, establishing policies and procedures. Standardization of units will greatly help you with that process. And then, of course, with staff turnover, be able to keep a consistent delivery to your patient population. Purpose-built commercial vehicles. When I explored vendors and got quotes, I guess I didn't realize that not all vehicles are really made equal in the space, especially as this becomes a more important care delivery model across the country. There's a lot of vendors that are getting involved. Some may use used vehicles or even rehab or refresh RVs. Especially off the chassis shortage that COVID supplied. These are not purpose-built medical grade vehicles. They're not as safe as a vehicle designed to the chassis specific for mobile healthcare, as well as the internal build out of that vehicle being at healthcare grade in terms of the quality of materials. Consider too, when you explore those purpose-built vehicles, really understanding their warranty and support. Sometimes the insurances can be too good to be true. There may be several ways you can identify that, but you can ask, what is the size of their fleet that they warranty today? How long have they been supporting their customers? How do they make things right? Do they have a parts department or other access to quickly get you what you need and back on the road? So those are just some considerations with regards to purpose-built vehicles. And of course, whenever possible, you want to understand and make sure that their warranty is also supported by the OEM, the original manufacturer of the chassis, Chevy and Ford, as an example. And finally, develop trust and keep it simple. Develop good trusting relationship with your vendor. Each of you probably have a way to developing trust with those you work with. Understand how they are going to be accessible. Understand that when something goes wrong, they're going to make it right first and then worry about the rest. Understand and make sure there's no hidden costs in the way that they're going to support you. And then finally, it's so simple, I think. It's probably overstating a little bit, but it's simple when you have that good trusting relationship and lean on that vendor for all the years of experience they had in designing these vehicles and all the subject matter experts they have to support you in getting your vehicle on time, built with quality, so that you can focus on serving patients and not have to focus on the build of that vehicle. So with that, my information, my personal email will be shared, I believe, at the end of the slideshow. Feel free to contact me anytime. There's a lot to discuss about the pre and post implementation. I'm happy to help with that or redirect you to trusted vendors in the field and also other industry subject matter experts. We'll turn it over to Deanna to continue the presentation.
Good afternoon. Next slide, please. I'm Deanna Viets. I'm the Executive Director of the Brown County Board of Mental Health and Addiction Services. Brown County is a rural county in Southwest Ohio. Our southern border is on the Ohio River with Kentucky right across. And while we're a rural community, we are a pretty big county with 493 square miles that we cover. And transportation is a huge concern. Any meeting you go into in my county will tell you transportation is a big barrier that we have. So when we were presented with the Healing Community study, one of our considerations was how can we allow our participants, our consumers, to access harm reduction services without them having to travel for that. So obviously a mobile unit was a great idea for that. So instead of them having to come to us for services, we can bring the services directly to them. I am part of the Wave 2 community. So we came in the second set, and I was also part of the state CAB and part of the national CAB for the Healing Community study. So have been very involved with that. And it's been very beneficial, not only for my county, but also for looking at what others are doing and learning from not only the state, but also what was happening in the other states that participated. So our population is about 43,000, a little over 43,000. So not a huge amount. We do not have cities in our county, and I know that sounds kind of funny, but we have 16 townships in the county that we compose. So one of our goals with the unit is to try to touch each of those townships so that they know what is going on. They can see what services are available, and then we can try to make linkage to that. As you see in this slide, this is our unit. We opted to have a pretty traditional wrap on the unit. That's something that if you're choosing to have a mobile unit, you will have the option of what to put on it. While we were using it with the Healing study primarily for the harm reduction efforts, specifically access to MOUD and Narcan distribution, we knew that going in the future, we would also be doing vaccination clinics and some other outreach pieces. So it is owned by our health department. So we chose to put the health department wrap on it. On the back, it does have some magnets that have some Narcan information, and obviously with a magnet you can change that in and out. So we have that flexibility with that. Next slide, please. So this is a picture of the inside and one of our health department nurses. You'll see we've got storage space and a seating area shown here. In the back of the van, we also have a exam table and other space. So you have two distinct areas where you can meet with clients on the unit itself. You'll see some things that we have hung. Obviously, those can change. We've got a flyer there about Narcan. We have some shelving or some a piece that we can put different pamphlets in there. I will tell you, we have used the label maker a ton so that we know what is in what. We have different folks, typically within the same 5 or 6 people that work on the unit, but having it labeled makes it much easier so everyone knows where things are. You'll notice in the picture on the right, there is a printer there. So if the provider agency that we have that travels with us on the unit is able to do a direct assessment for an individual, they can print the releases or they can print information that we might not have readily available for them. So that was a nice add-on. Storage is a huge piece. So we keep a lot of things on the van all of the time. And then when we're going to different events, we also use it as our transport to take the bigger items so that we don't have numerous cars making the trip to whatever it is. So that's been very beneficial as well. One of the considerations that you want to have with it is, what is it that you're going to be doing with the unit so that you can design it accordingly. So as we have been using it for a little over a year now, we probably would not do a bathroom if we had a future unit that we were designing. Our health department nurse has absolutely banned us from using it, and it has become a big joke that we're just going to use it to make her mad. But that reduces the complication of having to get rid of the waste and those kinds of things. Now, with that being said, we know that it's a potential at some point that we would deploy the unit for a crisis response. So if we had a natural disaster, we might use this as a command center, and having that bathroom would be very valuable then. So just kind of weighing, while you have a primary usage of it, is there another use that it might fill, and then trying to accommodate that when you're looking at what to put on the unit or what not to have on the unit. Another thing, we've gone back and forth, like the exam table that we have in the back room is helpful, although probably we could get by with just a phlebotomy chair in the future if we had to do it over again, and that would afford a little bit more space. While we are, since we're past the healing study period, we do have the opportunity to use the van for things other than just harm reduction efforts or other than MOUD or SUD efforts. So when you're doing vaccinations, there are some people that might need to lay down to be able to do that. So there is an advantage with that for sure. But just keeping those things in mind is helpful. Also looking at, I believe it was mentioned before by Paul, looking at where you're going to have it stored, what components you're going to have with that. So we were fortunate to partner with our sheriff's department, and the van is stored in their back lot by the jail. We also partner with them on the usage of their gas, so we don't have to try to maneuver it into a gas station. Again, you don't have to have a CDL for it, but not all of us are the best at driving larger vehicles. So being able to pull right up to a single pump is a benefit, and there's also a cost benefit to that. We don't use our unit currently during the probably January, February because of the weather. And our budget is about $1,000 for gas, which I know is low. Again, I haven't gotten to it yet, but we go out about once a week with the unit. There are some weeks, like next week, for instance, we'll be going out every single day as part of the overdose awareness activities for the community. But keeping that in mind too, when you're looking at budgeting, who's going to carry the insurance, those kinds of things. Also, we have not had it stored inside. So for the winter months, looking at the option of, is there a facility inside that you can store it so it does better with weathering? We are looking at options for that going forward, and our health department is going to be changing their location in the next year or so. So we're looking at what we can build potentially at that new location to be able to house the unit as well. Next slide, please. In the Brown County, while we're small, we do have quite a few different programs around harm reduction. So we have a syringe exchange program that is available once a week. We haven't used the unit primarily as syringe exchange. However, we always have some syringes on hand with us since the healing study again, since we've moved past that. So if someone who has been a participant or knows that the health department does syringe exchange would happen to see the unit out and about, we have some syringes available and some harm reduction supplies that we provide with that available on the unit. We also have MOUD available, obviously, with our provider agencies in the community, but it is also available in our jail. And that has been something that has been interesting with the unit when we're out and about. One of the social workers who works in the jail is also one of the outreach people who goes out on the unit with us. And she has run into individuals who have been in the jail and she's met with them there. So when they see her in the community, that rapport has already been built and they realize that it's safe for them, to come over and talk, whether it's specifically about treatment or, how she can help them further get into successful life, I guess, whether it's linkage with her or with other provider agencies. She is able to do that, and having that familiar face, I think, is a benefit with that. We have harm reduction vending machines in the county, and we've got linkage to that on our unit, so people can register for those. One of those was procured with the Healing Community Study. We had one in place prior, but we were able to expand that. And then we have Nalox boxes throughout the county. And sometimes when the unit is out going to an event, we'll put a bunch of Narcan on and be able to fill those boxes or to check in on those units, as well as drop needle sharp containers in some of the community spaces. So we can check that while we're out on the van. So it's kind of a double benefit. While we're out and about, we can stop, but it also allows people to see the van and to familiarize themselves with what the health department does. I don't have a levy, nor does the health department currently, and it is one way that we're looking at building the community knowledge of what we do and the accessibility to the community as a whole by using the unit. So if we get to a point where we are going to put a levy on the ballot, we see that as a big benefit. We have used the unit since we've switched from the Healing Community Study for health fairs. So as I mentioned before, we have 16 different townships. This summer, we scheduled an event in each of the townships and brought together the community partners who provide services, whether it's our Department of Job and Family Services or our community action provider, our treatment providers, as well as churches, food banks, just anyone who can be beneficial in the community. We brought them together in these townships to highlight what is available in the community. I'm sure that you're aware, oftentimes we assume that everyone knows what we do, and that is not the case. So having that availability to highlight what is done and to connect with the people in their comfort zones is a huge benefit, as well as just being able to do that networking with each other. So I was able to attend several of the events and hearing what some of the partners were doing that I wasn't aware of, was helpful. And then looking at ways that we can partner together more. So obviously having those partner organizations is key. None of us can do this work alone. And I think that our partnerships have strengthened in the last few years as a result in doing some of this work together. Next slide, please. So I talked about this a little bit already. One of the huge benefits with the unit is that workspace storage, making sure that you have ample storage. And like I had said previously, we store things even when we're not actively using the unit. So we don't have to take it on and off. So that's a benefit. Already talked about the consultation and exam areas. The wheelchair access was a big piece. You know, we didn't want to not have that availability in case we had people in the community who needed to utilize that. I will say that it serves another purpose as well. So when we're doing our events and we have heavy items that we're taking on and off, it is a wonderful way to lift it up so that we can save our backs and not age as quickly as we might otherwise. And then the necessary medical equipment and supplies. You know, like I said, we've got that exam table. We have some of the items to be able to take vitals and that sort of stuff are on the unit itself. We did not put a refrigerator on the unit, but if we do vaccinations, we would carry coolers on to be able to do that. Again, looking at whether you need to be using the generator or not, like it was mentioned before by Paul, that is very noisy and it does up the likelihood of repairs and that sort of thing. So having those considerations. Another feature that the unit has, if you remember the very first slide, you saw my unit right by the river and we had the awning out in the front. That has been a huge benefit. We often set up with the awning and have a table of information outside of the unit and set outside. So then if someone comes up and they want privacy, we can go on the unit. But it's just kind of a homier space. It's nice for us to be out in the weather, although depending on the weather, sometimes that's not good. But having that awning makes it nice to be out and about and more visible. So if they don't know what it is, they might see some of the items that we have setting out and that would entice them to come over and to talk with us. Next slide, please. So looking at the at-risk populations, you know, we all kind of do the hotspot areas, looking at where our most vulnerable individuals are. And in our case, often the most vulnerable individuals are in the areas that are food deserts, that are don't have the services readily available there. They have to travel to it. So using the mobile unit to be able to go to them is a huge help. We try to strategize locations within those areas where we can park. So there are a handful of different spots in each of our townships that we've been able to utilize, and we try it out and figure out what works. It's kind of trial by error situation with that. We've partnered with our law enforcement agencies on that, as well as our first responders, so our EMS. A lot of our EMS are volunteers, so that gets a little trickier because they aren't always there, but we have developed those relationships. And I will tell you from experience with law enforcement, we were doing an outreach, I don't know, it was last summer, I believe, and the chief of police he stopped by and was visiting with us. So his squad car was sitting there. He's in full uniform talking to us. And amazingly, no one stopped by during that time. So while, you know, having those relationships are valuable, keeping that in mind that it might be a deterrent for individuals who are actively addicted or looking at harm reduction options when someone is in uniform. So, you know, we kind of said, you know, we love you, but you have to leave or we're not going to have anyone stop by. Building community trust is a key. Again, allowing people to know what happened. So you don't want to be a best kept secret. A lot of people don't realize that the health department does the various harm reduction efforts. They don't realize that we have access to various MOUD and to treatment and that kind of stuff, because until you need it, oftentimes you aren't aware of that. So making sure that you're someone that can be approached is key with that. And then culturally competent services. Brown County isn't a hugely diverse county. And I'm not saying that to say that cultural competency isn't important. It certainly is. But we also have to think about it not in the true traditional sense. So we're an Appalachian culture, and that comes with a little bit of a different approach. People need to come to you. They aren't as willing to seek help. There are a lot of different caveats with that. So keeping that in mind when you're looking at who you're serving. So if you're going into a community with individuals that look different than you, trying to make sure that you figure out how to have that inclusion, I think is important, and will take you long or further in serving that population. Data-driven strategies, again, looking at those overdoses. We're a pretty small county, so it was a huge benefit with the Healing Community Study to be able to see our hotspot areas. We don't have enough of a population to really be on any of the state-driven maps with that, which is a positive thing and a negative thing. So that's helpful. Next slide, please. So again, I already talked about a lot of the best practices that we are doing in our community already, making sure people know that. Monitoring and evaluation. So I mentioned some of the other harm reduction efforts that we have. We have made it a point to quarterly get together and look at what our goals are and objectives, and make sure that what we're doing is correct, or that we're optimizing our time and our resources so that we can serve the folks the best, and also making sure that we're taking care of each other. So there's burnout in this area for sure. And we make sure that we afford a time to take care of ourselves so that we're able to take care of other people. Sustainability, looking for different grants, making sure that you are able to pool some funds and make the best effort, get the biggest bang for your buck with that. So we have a lot of different funding sources that we are able to utilize to ensure that this work continues. My information is available at the end of the slide, and I am happy to answer any questions at any time about this, about rural communities, whatever. Feel free to let me know that. I will say that the unit has certainly allowed us to do way more outreach than we would have been able to do otherwise, and to provide the community with education. So it has been a huge add-on to our existing services, and I highly recommend it. So I'm going to pass it on to Maj. Thank you very much.
Next slide, please. Hi, my name is Maj Berryman. I'm the Supervisor of Injury Prevention for the Toledo-Lucas County Health Department. So most of the funding that I oversee focuses on overdose prevention and harm reduction, and that's where we were able to implement this mobile unit that I will be talking about. And I also noticed a lot of questions in the Q&A around syringe service program, so hopefully I can speak to some of that a little bit more here too. Next slide, please. So my program is located in Northwest Ohio, where I actually have a team of 7 working on overdose prevention and harm reduction initiatives, such as community-wide naloxone distribution, including some strategies that focus specifically on special populations and health equity. We also do linkage and navigation efforts for the entire Northwest Ohio region. And then we have our syringe service program, which is the Northwest Ohio Syringe Services, and I'll also refer to that as NOS. Next slide, please. So why a mobile unit? Well, before I get too far into this presentation, I really just want to say that you really don't have to wait until you have this fancy mobile unit that costs hundreds of thousands of dollars to be mobile. You simply just need to go where the people are. And I think that's a really good message to kind of start off saying. So that's really the root of this type of strategy, right? So prior to this unit, we actually rented a gutted Sprinter van. And then we also practiced kind of using our own personal cars as well, working out of the trunk, bringing tailgate tents with us places. And even to this day, there are days where the mobile unit's already in use by another team member, or maybe it's getting work done. And we still have to rely on those alternatives to stay consistent with our practices. Preparation and practice are going to put you in the best position to show the need for this type of strategy. So I really encourage you to implement some of the takeaways from this presentation in whatever way that might make the most sense to you. It's also going to put you in a really good position to get up and running when and if you do move forward with a larger unit, so you don't have as much preparation to put in place then. But when COVID-19 hit, we really started to consider ways to better reach the community almost immediately. So we were very aware that the effects of COVID were not going to be positive for substance use and overdose rates. And we wanted to make sure that our momentum for overdose prevention just kept moving forward. So like I said, we explored a few different ways to be mobile through some different grants that we had. And then not long after that, we started working with the Healing Community Study, and we built a strategy around targeted naloxone distribution. And we were able to get the mobile unit that you see here. So since the Healing Community Study, we have since expanded the services that we offer on the mobile, which I'll talk about in a little bit. But also, because of that previous experience, we had already identified high-risk locations all over the city, and we knew that beyond COVID that this was a practice that we really wanted to implement and to continue to engage hard-to-reach communities through. Next slide, please. So the services that we currently offer on the mobile include our full syringe service program. So we're a needs-based syringe service program that's going to include your typical syringe service supplies. We also do linkage to care, including MOUD and other social services, HIV, Hep C, and syphilis testing, as well as other direct treatment referrals. And then we also do wound care evaluation, injection site review, and then some basic first aid. Because our team does have a nursing component, we did design a 2-room mobile unit, which has a nursing station in the back, kind of similar to the Brown County one, where we have that phlebotomy chair, we have a sink, we do have a fridge, and then we have some extra workspace. And then the front room serves as an area for consultation and really managing the other components of the syringe service program. So we also use the mobile for other types of outreach events too, like targeted naloxone distribution pop-ups. We've done specific disease testing events in high-risk neighborhoods. We've visited schools and career fairs, which is always really rewarding to get to kind of show harm reduction to youth in a really safe environment. And then we've also been able to participate in festivals and parades like Toledo Pride, which is what the photo here is from. So next slide. And obviously, just when it comes to planning and design, I want to point out the obvious that our mobile looks quite different than the subtle mobile that Brown County has. But this was really intentional for us. And first and foremost, we do have a history here of repurposing things at our health department, and we wanted to make sure there was no confusion on what program that this mobile was purchased for and who would be using it. And then second of all, we do have kind of a more progressive city. So we thought that it would be really helpful to continue working towards the destigmatization of harm reduction initiatives. We love when people recognize the mobile, maybe they honk or wave, which happens quite a bit. They also do the opposite. That happens sometimes too. And the only thing that I would really change right now is that I would have probably preferred to use the word naloxone rather than Narcan on the outside of it. But other than that, we're really happy to have such a obvious nod to harm reduction on the side. My biggest piece of advice when considering the design is to really take the time to talk with other mobile service providers and learn about their experiences with their mobiles. By doing this, you can find out what they like, what they didn't like, what they would have done different. I'm going to assume most companies that you work with would have references like this. I know we've been a reference for Tesco several times now. You're also going to want to consider how you want your services to actually like flow. So what services you need to offer versus what services you can kind of adapt to still offer versus what you're just going to kind of eliminate because you're working in a mobile space. So this is going to include how your staff is going to operate inside and outside of the mobile, but also how you're going to have people come to the vehicle and how you want them to kind of move through the services that you're offering. So do you want to bring them on board the vehicle and have them move throughout the vehicle in a very natural way? Or are you going to do things kind of food truck style? Like you see here in this picture where Joe educating kind of like outside the mobile. Don't sit on the countertops, by the way. We learned that that's not a good thing. So bad example. But this is going to help you build and kind of design what you want inside and outside of the mobile. So you're also going to have to consider what inclusions that you need to actually perform the services and really weigh out the responsibilities. So 2 examples of this that I like to always share with people is, you know, when we designed this, it was the height of COVID. We were really thinking about vaccine, very similar to what Deanna had just said about Brown County. We did decide to go with a fridge, but what we didn't realize is that unless the mobile is like plugged in all the time or the generator is running, the fridge is never really going to get to the temperature that it needs to be at to do like vaccine. So we're always going to have to bring a cooler on board. So if we could have gone back, we could have probably eliminated the fridge, just built in extra space. The other example that I like to give is the bathroom. We did decide to not get a bathroom on our mobile unit. We're always at a location that has a bathroom for our staff, and if a participant needs to use a restroom. The biggest thing with that was that, you know, our staff is going to be the ones taking care of this, and that just wasn't part of the maintenance that we felt was in our capacity to do and to worry about. So we just decided to eliminate that altogether. But I will tell you, whatever services that you plan on doing, just estimate way more storage than you think you're going to need. Trust me, you'll need it. And plan on buying a ton of bungee cords and other types of storage organizers. So with that being said, definitely make sure you consider a budget for any of the additional items that you're going to need to operate functionally on the mobile. So like I said, that can range from, you know, your storage organizers. Maybe you need additional fans and heaters. Do they need to be battery powered so you can cut down on generator use? Fly swatters, cleaning products. The list can really go on and on. So definitely make sure you have some funding that's identified for those types of supplies as well. I also really want to harp on safety when considering your design. So consider ways that you're prioritizing the safety of your staff and your participants while you're in the field. So this could be through, you know, getting mirrors or cameras that give you that 360 view of the outside of your mobile, so your staff can see where everyone's hanging out, and you can keep an eye on things in case something happens. And then this is actually something that we have had to address and add after the fact because we didn't include it in that original design because we weren't really thinking about it then. But also planning your visits ahead of time so that everyone's on the same page of how your visit's going to go. So that includes planning how you're going to enter a parking lot, how you're going to exit a parking lot, kind of where all your exits are, how you're going to park, how you're going to set up your services to flow, where you think your participants will line up, where you think your participants will park when they come get your services is important as well. And then just make sure that you consider with mobile efforts, you're going to lose a little bit of privacy. So consider how you can leverage landscaping or buildings and just be a little bit strategic if you can with how you park to kind of make up for any lost privacy there. The last thing I want to touch on this slide is maintenance. It's really important that you understand and prepare for the maintenance that needs to be done to maintain a vehicle of this size and specifications. So identifying what businesses will help you with general vehicle maintenance, generator maintenance, bodywork, I mean, things just happen. And then learn as much as you can about that maintenance schedule. So to give you an estimate, we use our mobile about 4 days a week throughout the entire year. So we budget for about $10,000 a year for maintenance and gas. Some years we've spent less than that. Some years, like this year, we're having to go over it because it's we're having some generator issues that just naturally happen. And so I really recommend, if you can, just braiding different funding sources to really help you cover the various costs that are going to come up with maintaining a mobile unit. Next slide, please. So when we were forming the strategy with HCS, we tried to take a really community-driven approach when we were implementing this strategy. So we actually brought partners in to consult during the design and planning stages, a treatment center, different law enforcement and public safety partners. And by doing this, we were able to identify locations to launch services right away. So implementation was super seamless, and we were really able to jump right in right when we received the mobile unit. We now have several new partner locations where we're able to just kind of freely operate the mobile when we need to, but 2 of them are now weekly stops on our syringe service program calendar. And then we've also been able to transition some of our fixed locations to operate in the mobile on like the nicer days and get more visibility being outdoors, rather than being inside of that location. So that's been really nice too. Like I said, we tried to market the mobile and we still do as a community resource. So when we got it, we took it to coalition meetings, we offered tours, and then even to this day, if we're going out to meet a new partner or we're going to tour a partner's facility, we're driving the mobile because it's an opportunity for us to show them what we do and then give them the true mobile experience, which was really great too. And it also helps partners see how they might fit into our programs and helps us build partnerships that expand our capacity. So we have that second room in the back. And like I said, sometimes our nurse is using it, but sometimes it's used for testing and treatment provider partners. So like that first picture, that's a partner of ours that does Hep C testing and mail order Hep C treatment. It's been really great to bring on board and partner. Even though we do Hep C testing, it just kind of helps us expand our capacity a little bit so our nurse can focus on some other things during that clinic time. And another really good practice is co-location. It's a really good concept to consider when you're looking for outreach locations. So this could be, co-locating with a treatment center or an FQHC or other type of social service agency. And it's really mutually beneficial because not only are you able to serve their participants and their clients with services that they aren't providing, but you're bringing new folks directly to services that they may want or need to use. And then last, just really considering using data to drive these decisions. So we use available overdose data through OD map to identify hotspots. And so that's kind of like a screenshot of the last photo here. You can see the white stars are our weekly syringe service program sites, and then the blue stars are where we frequent for pop-up sites, pop-up naloxone distribution, where we've done different types of maybe like syphilis testing event or things like that. So you can see that we really try to be intentional about bringing service directly to those areas. Slide 6, please. And then here I wanted to share, that was weird that I said slide 6. I'm sorry, that threw me off. But here I wanted to share some of our recent outcomes. One point that I think is really fantastic is that over 1/3 of our naloxone distributed last year, so 2023, was done using the mobile unit. Like I said, we have a team of 7 overseeing many community partners who distribute naloxone on our behalf, about 30 community partners that are service entities of ours. And then we also have staff that are dedicated to other types of outreach that are, beyond the mobile unit. So 1/3 of Narcan distribution is pretty significant for us. And because we're able to form so many new partnerships with new locations, about 70% of our new participants last year engaged with the mobile unit first. So it's a really good way to get people introduced to your program and get those new participants and get them engaged and educated on what it is that you do. One thing that is surprising to me is that visits between the mobile unit and our fixed locations are still about 50-50, which makes the following points even more interesting. But, with our fixed locations, we still are able to keep some of those other services that we're able to do. I think people have a little bit more time or build a little bit more time into their visit to do things like pregnancy testing, or we also do more HIV, Hep C, and syphilis testing at our fixed locations. I think there's just a little bit more of a comfort level of being inside, not feeling so rushed, not standing outside a mobile unit. But back to the next point is only about 20% of our syringes collected for disposal are collected on the mobile unit. And there's a few reasons of this. So one of them obviously could be the amount of new participants that we see that might not have used syringes to return to us on our first visit, but or on their first visit. But the other reason could be that there's a significant loss of privacy that a mobile unit can contribute. So this might make folks feel unsafe, bringing in used syringes, which is often considered paraphernalia, back to a program. And this is really where I shamelessly plug the push for needs-based syringe distribution. So having exchange requirements that influence the amount of supplies that folks can access is going to hinder your programs and impact your participation. It's just unreasonable and restrictive practice. So I really want to encourage you to make that consideration if you plan on doing certain service programming through a mobile unit. We also distributed only about 1/3 of our syringes overall through the mobile, even though our visits are 50-50. Again, likely because of new participants, it does take consistency to build a relationship where a participant might feel comfortable enough to tell you what their true needs might be. Like they're kind of trying to figure us out too. So we also always allow participants to collect supplies for their social networks through secondary distribution. So this is just really where showing up and being consistent is really important to building relationships with your participants. And then last, which is a really, really fantastic statistic that we were able to find and kind of pull out, was that our mobile and being able to move around the city and county has helped us do a much better job of reaching our Black community. So our data shows that our mobile is actually 75% more effective in reaching Black community members than our fixed locations. Next slide, please. So here, I'm just going to kind of wrap up. I touched on a few of these already, but I really want to talk resource management really quick and just really emphasize that being on the mobile is physically and mentally way more taxing than you might think, especially if this is a main source of how you're actually running your program. So it means super long days outside in high heat, freezing temperatures depending on where you're located. You're going to have crappy days where it's super rainy and just bad weather, really windy, but you're also going to have really beautiful days too. But taking care of your staff and making sure you're building in space for check-ins and trying to address possible burnout is really important. And then when you're trying to be consistent, you don't really want to be derailed by staff call-offs. So making sure everyone on the team is cross-trained on the ins and outs of using the mobile unit is really important. We do practice driving days with any new staff. We always ask in interviews, are they comfortable driving a larger vehicle, just to kind of gauge like where we're at. And then we'll take staff out to parking lots or, down different roads that we know are maybe less populated, to make sure they're comfortable with driving the unit of that size. And that actually really helps us with sharing the responsibility of who's doing what, who's responsible to go get it. What if someone calls off? Next point I want to kind of touch on is participant communication. If you're able to build ways to communicate with your participants on where you're going to be, that's really helpful when you're doing things mobily. We have a text alert line that works really well. It goes out about a half hour before we launch our services, and it has like the location, the time, information. It's anonymous, or it's confidential to sign up for. So we really just need a phone number. And we have about 3,000 participants signed up on it. So that's really great. And then last, we aren't the only ones who are going to be uncomfortable in bad weather. So just considering ways to make participants a little bit more comfortable too, I think is really important. Adding awnings to shield from the sun or the rain, having extra chairs on hand to set outside in case folks need to take a seat. Sometimes we have to set up, an extra tailgate tent outside for cooling stations or just to kind of get some more shade going. This is a really huge help to people who are accessing your services. So again, just considering things that you need beyond the actual mobile is going to be really important. And I think that's wrapping it up for me, but I'm definitely open to any questions and to being contacted. And I'm going to kick it back over to Paul. Thank you.
Yeah, next slide, please. So for more information, you can see our website, u.osu.edu/HCS Ohio, to access how-to guides, success stories, and more. These were developed by the Ohio team to share HCS successes and guidelines for implementation of various study strategies. Next slide, please. And again, here's the contact information for everyone. And with this, we'll turn it over to Jamie Luster, who will moderate the Q&A.